Hey, this is Dr. Tom Rogers at Performance Medicine, bringing you the weekly update. I've had an interesting week, and it really reminded me to talk about a subject that's dear to my heart, Alzheimer's disease. Many of you know my mother died of Alzheimer's, my grandmother died of Alzheimer's, and it's just a terrible disease, one of the worst things that can happen to you. And it's more particularly a woman's disease. Women have dementia, and Alzheimer's is just the most common type of dementia, 4-to-1 over men. And it's not just because they live longer. They're more predisposed to it, mainly because of hormones, which is one of the main things we do in our practice. But anyway, so I thought I'd just riff a little bit about updates on Alzheimer's disease. I spent the past week in Hilton Head at a pickleball tournament. Now, I'm traditionally a tennis player, but I'm getting into pickleball, and the reason I mention this is because there were just hundreds and hundreds of pickleball players in Hilton Head, mostly older baby boomers like me. It's just an interesting game, and I think it's one of those tools that you can use to prevent dementia. And I think pickleball is particularly useful, and I'll tell you why at the end of this podcast. But a little update on Alzheimer's disease. They did some studies on kids with ADHD, which we also treat a lot of at Performance Medicine. And we treat mostly adults with it, but it always begins in childhood. Once you have it really. And some people cope with it better than others. At one point in your life, you may realize that you need treatment for it because you're overwhelmed with life itself and you can't get organized. So I've certainly seen medications used for Adderall that have changed people's lives for the better, but it needs to be properly diagnosed and treated. But anyway, so there was a study out of Sweden that I looked at recently. It was, I think, 2 million individuals and 5 million relatives of kids that had ADHD. And there was a significant increase in the amount of dementia, particularly Alzheimer's dementia, in parents and first-degree relatives of kids that had ADHD. As you know, ADHD is very familial, a lot of genetic components to it, whether it's environmental or totally genetic or epigenetic, as we say, probably both. But in any event, it definitely runs in families. So it turned out that there was an association for an increase in risk of dementia in people that had ADHD. So that's something you need to think about. The significance of this study, we don't know yet. There's a lot of unknowns about this. But the reason I really wanted to talk about Alzheimer's was there's a new drug that's been approved by the FDA for Alzheimer's dementia, and it's called Aducanumab. It's actually a monoclonal antibody. It's another drug that reduces amyloid plaque in the brain. But after years of research on trying to do this, it doesn't work. It's just a failure because the amyloid plaque in the brain is not what causes Alzheimer's disease. Actually, the amyloid plaque is the brain trying to protect itself against inflammation. So if you want to get to the root cause of Alzheimer's dementia, getting rid of amyloid plaque is not the answer. So this new medication, which caused a lot of consternation within the FDA, I think they even had a couple resignations over this as well, but it really hasn't shown to work. The families have noticed no difference at all in these Alzheimer's patients when they take this drug. And in about 41% of the people that take it, it causes their brain to swell and cause terrible side effects. It also comes with a price tag of $56,000 a year for medicine that probably doesn't work. Um, you know, if I would at first, I would try something much different. I'd even try CBD oil on Alzheimer's patients. I've used stimulants, actually, that I used to treat ADD with patients that are getting dementia, and it works quite well. It also works very well in treating long hauler COVIDs, and I can guarantee you we're going to see a lot more neurological illnesses in the next few years because of the damage that COVID can do to your brain. There's no doubt about it. They're going to see a lot of this, a lot more Parkinson's, a lot more dementia, because COVID definitely gets in your brain. So there's a new drug out for Alzheimer's disease. It's unbelievably expensive. It barely passed through the FDA. It was unbelievable. Shocked everybody that it even passed. But it really hasn't shown to work real well, and nobody could really afford it anyway. So unless something major happens with this drug, I'm not real hopeful about it. The other two main drugs that we've used through the years don't work either. One of them, the first one was Aricept. It's a cholinesterase inhibitor, meaning that it increases acetylcholine in your brain, which is it helps nerve synapse transmission, but it causes a lot of side effects and just hasn't worked. They say it may help for at most a few months, maybe. The other one that came out that was supposed to be great was one called Namenda, and that works to regulate the glutamate in your brain, which is a complex process, but the bottom line is it really doesn't work very well either. Neither one of these drugs will prevent or really slow down Alzheimer's. And this new one certainly hasn't shown to be real effective either. Again, it's brand new. I hope we can get better bad news out of it, but the news so far has not been positive, and a lot of side effects from it. And the expense of it's just unobtainable for most people. So I would try to do everything else that you can do. One thing that I've kind of gone by the last several years, I've been to courses about it and taken courses in it, is a protocol called RECODE by Dr. Dale Bredesen out of UCLA, probably one of the preeminent researchers in the world on Alzheimer's. He's a famous neurologist. And the book he wrote, The End of Alzheimer's, is really telling because there's so many different causes of Alzheimer's disease. They've identified 33 of them, and really it's a lifestyle intervention that they use to. They've actually reversed Alzheimer's disease. For how long we don't know yet, but they've actually reversed it almost entirely for a period of a few years. But definitely that's the way to go, is always prevention, especially in something like a neurodegenerative disease of the brain. So what does he recommend? Well, everything we've been recommending at Performance Medicine for many years, like hormonal evaluation. We know the less hormones you have, especially women, estrogens, the more likely you are to get dementia. You need to eat a low glycemic diet. You need to eat an anti-inflammatory diet, like low grains and low sugar. Intermittent fasting, certainly. And take your supplements that help, like vitamin D, the granddaddy of all supplements, omega-3s, which is the next grandmother maybe. Turmeric, curcumin are all very helpful. All those fat-soluble vitamins. And eat more good fats. A ketogenic diet certainly very helpful. Look at Dr. Amen's protocol, another famous doctor. Look at your stress levels. Keep stress down. Look at how you sleep. I mean, in kids, bringing back the ADHD, in kids that have it, a lot of times it's been postulated that a lot of it's caused by obstructive airway disease in these kids, like large tonsils. Some studies have even claimed that if you take their tonsils out, if they're enlarged and it's obstructing their breathing, it may bring a 40 to 50% reduction in the diagnosis of ADHD in these kids. And in adults, you always look at the airways too. Look for sleep apnea, because there's no doubt that that's a risk for dementia and cardiac disease and early death. So look at the airway diseases, look at your sleep patterns. But the last thing I want to end up with is exercise. Of course, exercise is the number one thing you can do for your health, bar none, whether it's anxiety, depression, prevention of heart disease, cancer, decreasing mental stress, sleeping better. Exercise is number one for me. And when I came to Hilton Head and looked at all these older baby boomer pickleball players, I mean, they come in all sizes and shapes. I mean, anybody can really play pickleball. And I kind of was hesitant about pickleball at first, being a tennis player, but it's a really cool game because it's almost like a combination of ping pong and mini tennis or paddleball. It's just a game that's, you're going to get some exercise doing it. You're certainly not going to kill yourself doing it, so it's moderate exercise. You don't need to go to extreme exercise. You probably shouldn't, especially at a certain age. But it also has a unique scoring, so you really got to think about the score. Every point, you're really calculating and counting the score. There's certain times when you can score and certain times when you can't. And it's just a unique scoring system. It really makes you think. It keeps your brain working. It's a lot of people think that the best exercise in the world to prevent dementia is ping pong. Now, I would definitely say it's pickleball. Pickleball is a cool game. It's fun. It's a very social game. It's not too stressful a game. You're definitely going to move, and you're going to have to use your brain. Plus, it's a lot of fun. So think about playing pickleball, all you baby boomers, and I hope a lot of younger people will start playing it too, because it's just a lot of fun. And there's a lot of skill levels too. Saw a lot of professional pickleball players from all over the world, and they're really good. It's surprising when you look at the really best players. So I hope this update helps. You certainly want to do everything you can to prevent dementia for yourself and for your family and loved ones, and certainly the lifestyle intervention plays a big part. But take care of your brain, take care of inflammation, all those lifestyle interventions that we preach every day at Performance Medicine. Take them to heart, because it's going to pay off later on. I hope this helps. Go play pickleball. I'll see you next week. The volley is the most important.